Hey guys, Dr. Brandon Crawford here. I'm the founder of the Austin Center for Developing Minds. We are located just north of Austin, Texas in Cedar Park. And what we do is we focus on developmental functional neurology. Hopefully you'll have a chance to catch my lecture because I'm going to be taking you through what that process looks like and why it's so important to focus on rehabbing the brain in the right way, at the right time, with the right frequency and oscillations and all this kind of stuff, right? So I'm very honored to be a part of this conference. This conference is very meaningful. I love all the people involved, and obviously the cause is fantastic. So thank you again, and I look forward to seeing you soon. Hey everyone, Dr. Brandon Crawford here. So I am co-founder of the company Shed Light. Shed Light is a company that focuses on the use of laser and light therapy to improve the health and wellness of the brain and body. We're happy and excited to be a part of this conference. And so, if you have any more questions or want any information regarding how laser and light therapy can improve your health, please check us out. Go to shedlightcoldlasers.com. Thanks.
All right. Hey, everybody. My name is Ryan Cedermark, and I'm a practitioner in Atlanta, Georgia. I'm working as a nurse practitioner, and I'm also a chiropractor. And within the chiropractic fields, I really got into the neuroscience behind chiropractic and understanding what we call receptor-based therapy. So understanding ways to stimulate the brain to help make the brain better. And once I got into that field, we found that we were able to really help people who suffered from brain injuries. So tonight, I'm going to be talking about what's called the brain-gut axis and how we can use some really simple strategies and the laws of neuroplasticity to help change the brain in a positive way if you've ever suffered from a brain injury or if a loved one has ever suffered from a brain injury. So I'm just going to share a little presentation that I made here. Let me get it pulled up for you. And so okay, so we're going to go to the slideshow here. Okay, so what I'm going to talk about tonight is basically what's called the gut-brain axis or the brain-gut axis. And what that means is basically how the brain and the rest of the body internally communicates, specifically the gut. And this was something that kind of fell upon me when it was about 3 years ago. I got a phone call about a young girl. She was 25 years old. She lived in Atlanta, but she had reached out to one of my friends that lived in California, and she had suffered a very traumatic brain injury. She was working for Coca-Cola as an accountant, and a conventional oven that was stashed away on a shelf had fallen down and hit her on the head. And prior to that, she had had a couple of concussions, but this one really just put her out. And over the course of a few weeks, she was unable to eat any food whatsoever. And I would work with concussions before, but that was the first time I had ever heard of anyone having difficulty with digestive issues that significantly after a concussion. So it led me down this road of trying to understand what the relationship was between the brain and the rest of the body and the gut. And the research that I kept reading kept falling back to what's called the vagus nerve. So I'm sure a lot of you have heard about the vagus nerve and vagal nerve therapy. And this was just an amazing case for me. So long story short, she had tried everything. She had done different types of nutrition. She had done what's called functional medicine. She was seeing a very well-known local gastroenterologist to help her heal her gut, but no one had ever asked her in her history about a brain injury. So when I saw her coming in, I knew that she had suffered a brain injury. So my thought process was, what's up with the brain and why isn't it telling the gut what to do? Because from the little bit that I had known, I knew that there was a lot of communication that happened. I just didn't really understand the exact mechanisms of it. So what I found out was that if we figured out ways to help her heal from her concussion by doing brain-based therapies, we would slowly be able to reintroduce foods. And within a week of working with her, she was able to eat complete meals again. And, I'm happy to say that ever since then, she just continues to get better and better and better. And that was 3 years ago. She just sent me a text a few weeks ago. She's had a baby. So she was also having all these endocrine issues and hormonal issues, and things just really started to fall into place when we started to focus more on brain-based therapies as opposed to looking at the area that was causing most concern, which was her gut. So that's what really got me interested in this, and that's why I wanted to present it today, because I think sometimes we forget that, if we do hit our head, we have all these cognitive issues, and we can have all these physical presentations of difficulty doing types of like motor activities or coordination activities. But it's important to remember that the brain also does communicate with the gut. So if your loved one has suffered from a concussion and you have digestive issues or anything of that nature, then the gut-brain axis is something that should be focused on with their therapies or with your therapies. So we're going to cover something called barriers, and our brain and our body have barriers all throughout the system. We have a skin barrier so we don't get cut, or if we do get cut, we have a barrier that allows it to heal. We have a lung barrier that's really important. It protects us from environmental toxins, and if it's working well enough, it can protect us from really bad pollutants and viruses. But then we also have a gut barrier and we have a brain barrier. So the two barriers I'm going to be talking about are what's called the blood-brain barrier, which is up in your brain, and then the intestinal barrier, which is in your gut. So the intestinal layer, it's a single layer of cells, but it's super duper important, especially when we consider eating foods, because it's one of the first barriers to come in contact with the outside world. Anything we put in our mouth, it's going to go through the stomach, and then selectively things are going to get chosen to use for digestion and use for energy. And that whole time, the gut barrier system is playing a significant role in keeping all the bad stuff out of getting into our bloodstream and continuing down the tube so that we poop it out. So if this barrier is compromised, then we have some issues that we can see, such as irritable bowel syndrome, food allergies, food sensitivities, lots of bloating and gas. And so it's just a really, really interesting barrier. And I always like to think of the barrier systems as something that should be protecting us. And when we have a breakdown in protection, then we have a breakdown in function. So we've got the intestinal barrier, and then we also have the blood-brain barrier. These are two very, very highly regulated systems in our body, which means that when they do break down, bad things can happen. So our body is always working continuously to try to make sure that these barrier systems are intact. And the blood-brain barrier system is basically a specialized barrier system that's in the vasculature of our brain. So it doesn't allow anything bad to enter our brain, and it helps bad stuff actually exit our brain. So when I think of barrier systems, the easiest way to remember this is sitting down on a nice, cool summer day on a screened-in porch in an area that usually has mosquitoes. So if you're on the porch, you can enjoy your time outside and enjoy the weather, enjoy the temperature, enjoy the breeze. But as soon as there's a small little cut in that screen door, for some reason, the mosquitoes always figure out how to get in, and they're going to go in and they're going to ruin your time on the porch. The same thing happens in the brain and in the gut. If there's disruption, little bugs can get into either the gut system or into the brain area and cause a lot of trouble. And it's crazy to me how if you are sitting on a screen-in porch and somehow a bug does get in, they figure out how to get in, but they can never figure out how to get out. And so they just ruin your day on the porch. So when you think of barriers, think about a nice screened-in porch. When the barrier system is working well, you enjoy the breeze. When it's not working well, the bugs come in and cause a lot of trouble. These are just pictures for you to see, just to kind of give you an idea of what it looks like. So these are little drawings. And on the left here, you see what's called the gut immune barrier. And the most important part about this is what's called tight junctions. So these tight junctions, you can see where the red is. Those are areas where the cells are all lined up together, creating a barrier. And it's a very selective barrier. It only lets important things in and keeps all the crud out. So you pass it down and poop it out. This barrier in the brain looks a little bit different. The tight junctions look a little bit different. But basically, if you think about just cells that are overlapping each other, not allowing anything to pass through, and well, only allowing certain things to pass through. So these are good-looking barrier systems. What can happen in stuff like traumatic brain injury and stress in chronic health conditions, these barrier systems can become disrupted. So to just give you an idea of what that looks like, in the gut, you lose the tight junction. So you start to open up those cells, and now bigger molecules and bigger proteins can leak in and cause it can actually cause an immune response that's not necessarily wanted, which can cause further issues down the road. And the same thing with the blood-brain barrier, you lose those tight junctions. So the cells kind of, they lose their overlappage, and you get things that can kind of come in and cause lots of trouble, right? So the tight junctions are kind of like bouncers. They'll like select things to come in, but they'll keep all the unwanted stuff out. So the ways of communication, what is the gut-brain axis? So the ways of communication, you have two ways. There's an actual, well, you have a couple ways. So you have the communication that goes from the gut all the way up to the brain. So you have all the stimulation that comes from your internal organs up to the brain. And it's super duper important for that communication to be working well, because the brain always relies on constant feedback from not only its external environment, but also from its internal environment. So you have things like what are called neuropeptides and immune cells, and then microbes. If you've heard about the gut microbiome, that's a super duper important area and concept that's important for brain health, which we could talk about at another time. But basically, the biggest thing that I'm going to talk about tonight is afferent vagal signaling. And what that means is vagus nerve talking from the gut up to the brain. And then from the brain to the gut, you've got different lobes of the brain that are talking down to the gut and communicating via the vagus nerve. So you have the frontal lobe, which is a common area to be injured in a brain injury. You have what's called the insular cortex, which is hidden a little bit deeper inside the brain. And then you have what's called the anterior cingulate gyrus and the brainstem, which is called the pontine area. And that means vagal efferent. So it's going from the brain to the gut. So there's lots of different ways of communication, and the communication is really, really important. So why is this important for brain injury patients? Well, when I started to do the research on that young girl who couldn't eat food after her brain injury, and you can imagine if you can't get food into your system, then you don't have energy. We use food as an energy source. So when you're not able to eat, not only you're going to be cognitively fatigued from a brain injury, but you're also going to be metabolically fatigued because you can't get any good nutrition into your system. So there was a paper that I came across, because as soon as I found out about this patient, I was like, I got to get her in here. I got to figure out how we can help her. So I started doing some research on, what is the relationship? What is the interaction? So this is a paper from, I think it's like 2009-ish, for any of the super duper nerds out there. But this is a paper that talked about the relationship between traumatic brain injury and the gut. And what they found was that in an injured brain versus a healthy brain, and these are brains of mice, they found that the injured brain actually very quickly after a brain injury would cause a disruption in the tight junctions. So you can see in image A here, kind of like that picture I showed you before, everything's kind of pushed together and really tight. In image B, this is about 6 hours after the brain injury. They took a sample of their gut lining and they found disruption in the tight junctions. So there was a breakdown in the barrier system, which meant that can cause a lot of issues between the brain and the gut. It can cause a lot of inflammation, bloating, difficulty with digesting, things of that nature. But in the healthy brain, it was like the sham mouse, there was no issues with the tight junctions. So they concluded that a brain injury can and will cause gut dysfunction in mice, which I was thinking, well, then that might be the same for humans. So this is another paper just kind of to show everyone what I'm talking about when I'm saying the gut-brain axis and the brain-gut axis. So this is a paper regarding traumatic brain injury and the relationship that the brain injury had with gut communication. And what it talked about was that the primary mechanism of injury, so like a traumatic brain injury to the head, would cause structural and functional changes and damage to the gut tissue. And that's via different pathways. And what they found, what I didn't tell you, I'm sorry, in this paper, what they found was that there was a disruption in communication between the brain and the gut via the vagus nerve, which is, it's our 10th cranial nerve. It's the biggest cranial nerve that we have, and it wanders everywhere, but it's very, very important for our parasympathetic rest and digest system. So this paper was discussing how if you have a brain injury, you can get gut dysfunction, and that gut dysfunction can lead to an unwanted immune response, which can create a lot of different types of what are called cytokines, which there's good and bad, but in this case, these were pro-inflammatory, which isn't a good thing necessarily, which would cause persistent inflammation. So now we're looking at a brain injury that causes gut dysfunction and disruption because the barrier systems are becoming disrupted. And then when they say persistent neuroinflammation, that means that there's a breakdown in the blood-brain barrier. So that screen door is opening in the brain as well. And now you're getting all these bugs coming up from the gut and causing more brain inflammation, which you could already have brain inflammation from a blow to the head. And now we're getting it from an immune response that happened via the gut-brain axis. So that's pretty interesting, if you ask me. And again, the barrier systems, stuff that's happening outside of our brain, so in the rest of our body, should be mediated by the barrier systems, like the intestinal barrier system, the lung barrier system. But in this case, if it gets bad enough in the peripheral system, so like in your gut, then it's gonna eventually cut a little hole in the screen door and make its way into the brain, causing more inflammation in the brain. And so what they found was, so the purpose of this is to say, hey, if this can cause damage, then maybe this brain gut brain axis might be something that's really, really important to use for therapy. And so then I started to go down the hole of, well, what does therapy look like for the gut brain axis, right? Because as a chiropractor doing neurological rehab, I understood how to stimulate the brain, but then I didn't really understand what would also stimulate the gut at the same time, to try to heal the gut and to try to heal the brain. So the research team that did this paper back here, they ended up joining forces again a few years later. And what they found was that if they did the traumatic brain injury 6 or so hours afterwards, they would find that it would cause a disruption in the gut lining. So the brain gut axis became inflamed and the barrier systems broke down. But what they did also was they provided what's called vagus nerve stimulation to the mice in this area right here before giving the head injury. Then they had a head injury, and they found that those tight junctions remained tight several hours, way further than 6 hours after, and some of them didn't even have an effect on the intestinal lining. So what that meant was that if you stimulate the vagus nerve, or if you have what's called good vagal tone, then there's going to be less disruption in those barrier systems, which means that the healing process is going to take way less time because you're not getting all that inflammation as an aside to the physical injury. What this paper also showed, which I thought was super duper cool, was that it dampened inflammatory markers with vagus nerve stimulation. So now you're seeing that if you have a brain injury, but your vagus nerve is really healthy and intact, you're less prone to get those concomitant effects or those other side effects of the brain injury itself. And it's also, with the vagal tone, you're going to have less of a bad inflammatory response afterwards. Because sometimes for brain injury patients, it's not necessarily, sometimes the physical injury will start to subside, but it's that persistent inflammation within their system that goes unregulated and unchecked that causes those persistent symptoms. So now we have to talk about the vagus nerve for a second, because this is where we're going to use neuroplasticity and different rehab strategies to activate the vagus nerve to make better communication between our brain and our gut. So the majority of this therapy is just going to be talking about the vagus nerve, but there's other ways to do this too. And I'm just going to share a few simple things that you can do at home, but it's also really important to find a provider that knows about transcutaneous vagal nerve stimulation or vagal nerve stimulation to help heal brain injury, because it's super duper important. So there are some super duper simple ways to stimulate the vagus nerve. I did some really super simple, silly things with that young girl that couldn't eat. And within a week, she was able to eat again. And the gastroenterologist was like, what did you guys do? Like, this is crazy stuff. But all we did was really stimulate her vagus nerve. So some of the simplest ways, and if you just go onto Google and you type in ways to stimulate vagus nerve, you'll find a ton of information, because this is a very hot topic right now. And it has been for quite some time, but simple things to stimulate the vagus nerve are deep belly breaths. So doing slow breaths in through your nose, breathing out with your belly. So like diaphragmatic breathing is really, really beneficial to the vagus nerve, because that slow distension of the stomach is sending some really great signals between the brain and the rest of the body. Meditation, it doesn't have to be an hour of meditation, just doing short 5-minute meditations. And there's some really good apps out there for meditation. And then also mindfulness practices. So interestingly enough, regarding mindfulness practices, I've become good friends with an orthopedic spine surgeon who doesn't do surgery anymore, because he found that doing vagus nerve stimulation exercises helped his chronic pain patients so much that he didn't need to do surgery on them, even though they had pathology, because the vagus nerve exercises were reducing their pain levels by reducing inflammation. So mindfulness practices, it can look something as simple as every so often throughout the day, taking 15 to 20 seconds to kind of just be aware of your body, be aware of where your feet are in space, feel your back, be mindful of your posture, drop your shoulders, relax your jaw muscles. Stuff like that is very, very simple, and it helps communicate the pathway between the brain and the gut and vice versa. But clinically, there's some really, really cool ways to do it too. So we're going to talk about that. So the reason we would want to do this is because when we stimulate the vagus nerve, you can increase what's called cerebral blood flow. So you can increase blood flow to the brain, which can help the neurons regenerate and replenish. And then also it can help move the fluid that's not wanted away from the brain. It can help reduce pain, like I mentioned earlier. It can increase the tight junction integrity, so it can seal up those cuts in the screened-in porch. It can help decrease stress, which stress is a huge killer. And what you'll find too in brain injury, sometimes it's very difficult to try to shut down the stress response. So this is a really good exercise to help reduce stress, or vagus nerve exercise is really good to help reduce stress. Vagus nerve stimulation can help decrease inflammation. It can help modulate brain function, so it can help make your brain a little bit healthier. It can help stimulate and activate the front part of the brain. And it can help with the blood-brain barrier integrity, so closing up those tight junctions and the screened-in porch that's in our brain. So just to kind of give you an idea, this isn't a brain injury patient, or these aren't that this paper talked about, but what this study did was they were trying to figure out a way to do vagus nerve stimulation, but not do it invasively. Because before vagus nerve stimulation became a hot topic, in the hospital, when I used to work in the hospital, they were doing, and they still do this, and it works really well for some patients, but they do vagus nerve stimulator implants that are electrical impulses that are placed on the vagus nerve to stimulate the vagus nerve. And I know of seizure patients that have responded very well to that, Parkinson's patients that have, and other types of patients too. But if we can do it where you don't have to go get a surgery, why not, right? That's way better. So a lot of the research shows that branches of the vagus nerve, they go out and they innervate, or they talk to parts of the outer ear. So you can use the outer ear as a way to stimulate the vagus nerve. And what this paper showed was that using vibration on different areas of the ear actually helped reduce inflammatory markers in rheumatoid arthritis patients, which, if you know someone who suffers from rheumatoid arthritis, you know that they're always looking for some sort of medication to help reduce the inflammation, because the inflammation can be debilitating to their function, but also their lifestyle as well, and their pain levels. So this is just to show you that we can use something called transcutaneous vagus nerve stimulation, which means we can use areas of the ear like vibration or other modalities to help stimulate the vagus nerve to help the brain gut axis. There's tons of ways. There's companies out there that create transcutaneous electrical vagal nerve stimulators, such as this one that you see here. There's little ear clips that you can put on a TENS unit to stimulate the vagus nerve. I'm not a huge fan of this one. It's not as comfortable as vibration would be or other modalities, but this does work. So it can help. And then there's also just using a simple TENS pad. This is going to the posterior area of the ear, but using a TENS pad, which is an electrical stimulator, has actually been shown to help stimulate the vagus nerve as well. So Dr. Brandon Crawford, he's going to be talking, I believe, and you'll hear from him, but he really turned me on to using laser therapy. And it's something that I had never done before, but if you even want to go less invasive, you can find a practitioner that uses low-level laser therapy. And just by shining light on specific areas of the body and the brain can help activate and stimulate the vagus nerve and also activate the brain. But if you don't have a laser, a way to use vibration on your ear would be, hey, grab a vibrating toothbrush at home, right? And the research, what they found was that this area of the ear really liked it. This area of the ear really liked it as well. And then this area over here likes it as well. So you can't go wrong with just doing some simple stimulation to the ear itself. Now, if we don't want to go directly, to the brain and to the ear, there's other ways to do it. So I made this silly slide for a class I teach, but what I found super useful, especially for that young girl that needed help with the brain gut axis, was having her husband at home just give her belly rubs, massaging her belly very gently. Because what that did was that stimulated the muscles. It actually got her guts to move a little bit more, and it made the vagus nerve almost wake up a little bit to say, hey, what's going on down there? Because she kind of after she couldn't eat, there really wasn't much happening down there, as you can imagine. So doing different types of belly rubs to the stomach, that can actually stimulate the vagus nerve, which can stimulate the brain via the gut brain axis, using light vibration. So something as simple as like a $5 handheld massage tool and just doing it on the belly, or using the laser as well on the belly, I found on the clinical side to be very beneficial. So I call it either the top-down approach, so using the face and areas of the brain to stimulate the vagus nerve, but also the bottom-up approach, so using the gut to help heal the brain as well. So I hope this made some sense to you guys. And what I really wanted to do was just kind of shed light on the fact that there is an access between the brain and the gut, and that if you have had a brain injury, looking to the gut to see if that area has been affected, just by simply asking the brain injury patient or a loved one, hey, are you having digestive issues? Can you not tolerate the same foods that you used to? Do you get nauseous a lot? Things like that, or have their poops change, right? Do they get constipated a lot? Or on the opposite end, are they going way too much? That could mean that gut-brain axis has been disrupted, and looking into doing vagus nerve exercises could actually really, really benefit not just their brain, but the rest of their body. Because I will say, I think if you don't address that axis, the gut-brain, brain-gut axis, then there could be that little persistent inflammation that's always trying to knock at the door of the brain and say, hey, let me in, I want to go cause some issues. So if you can control that and mitigate that through simple vagus nerve exercises, then I think you're a step ahead of the game. So I hope everyone enjoyed that. And if you have any questions, I run a Facebook page called Brain Chat, and I post daily information on brain health. It's geared and focused more towards brain injury patients, but it's also just about general brain health. And you could always message me on there, and I can get back to you. But the simplest way to start activating the vagus nerve, like we said, are doing things like short meditation practices, vibration stimulation to the ear, vibration stimulation to the belly, and mindfulness practices and deep breathing exercises. And that can go a really long way. So thank you so much for your time. And I hope everyone is staying safe and healthy, and hope to hear from you soon.